Hi, everyone. I'm Dr. Spencer Zimmerman, and I wanted to introduce you to this webinar on how to take control of your concussion and traumatic brain injury recovery using a functional approach. Concussions and traumatic brain injuries have been a passion of mine for the past 10 years. I started working with individuals that have been dealing with those for a really long time, from NFL to NHL, UFC, special forces, and really just anyone who is struggling. Saw many patients who flew in from around the world for care. And I fell in love with it when I was in school, and I never looked back. And unfortunately, I see this as one of the biggest issues where people struggle to be understood. They struggle to get the help they need. So I put together this presentation for you because I want you to understand how you can actually do it. Concussions and traumatic brain injuries are a complex issue, and they require a comprehensive approach. I'm going to review with you what are some of the common symptoms, the myths, what happens in the brain, how I help individuals recover. And during this time, you're going to see what info you're missing that prevent you from getting to the next level. And also, how do you reach it? We will also discuss what are long-term risks of these injuries as well. So how long have you suffered? Weeks, months, years, a decade or longer? If so, know that you are not alone. You're not the one person that people are saying, oh, you're crazy, you're just depressed, or you're just anxious. You're not alone. How many of you know you have suffered a concussion? Now, there are those of you who aren't sure and you're wanting to learn more. There are those of you that know for sure you have. Also, on the other side, how many of you don't know if you have? And then there's some of you that are just caregivers, loved ones of someone that have. And maybe you'll find out from this, maybe you're good, or maybe you actually have something in your past. How many of you have accepted a new normal? This is a trap that leads to suffering. Now, I'm going to explain what I mean by that. So there's a difference between normal and common. Common is something that we see a lot of, right? So it may be common for you to always have a headache, to always have brain fog, to have blurry vision, mood changes. That may be common for you, but that doesn't make it normal. And because whenever we normalize something, we actually no longer bring it up. I get patients who come in all the time. I'm like, hey, how are your headaches? Well, I only get a headache once every 2 weeks. I'm like, so no headaches other than every 2 weeks? I was like, no head pressure. Well, yeah, I mean, I have head pressure every day, but I actually don't consider it a headache unless I'm taking something for it. And it's like, so, so now you're only saying it if it goes above a set point. That means you're pushing through things and your recovery is going to be slower. And I don't want you to, because there's a way to actually get better. But why do I care? Right? Yes, I've worked with, pro athletes, special forces, and everything else like that. But why do I really care? Well, this is my family. So my wife, Sarah, she actually suffered her first concussion when she was about the age of 13 in a car accident. Took a whiplash injury, did a little bit of care. And she kept having symptoms, headaches, brain fog, fatigue, mood changes. Oh, doctor said it's okay. Everything will go away. And plus, you're also 13. So, you're going from one school to the next. You're changing friends. You're going through puberty and hormonal changes. So that's what's causing it. But she also took another one in high school and another one after graduating. And we didn't actually find this out until I'd been doing this work for a few years. And so I'm here like on cloud nine, working with patients that were flying in. I'm like, man, someone else, their brain fog, their dizziness, their headaches are doing so much better. Like, this is awesome. And after doing this for a bit, she was like, that's not normal to have some of those issues. And we knew she had headaches because she has got severe issues with gluten, most likely celiac, in which her headaches improved a lot, but she wasn't mentioning the smaller ones that she was having all the time. She wasn't mentioning the fog that she just lived in. So don't let that become you. Our brain defines who we are and what our potential is. I want you to respect and protect it at all costs. Don't wait. The time is now. The sooner you address something, the easier it is. Now, before we go into this too much, let's talk about the medication trap. So specifically, let's talk about headaches. So you've got a headache, you may do Tylenol, Aleve, ibuprofen, other things like that. Oh, my headache's gone, I can keep going. The problem is doing that doesn't change the fact that there's a reason why you got the headache. And it's not because your body's just like, I needed that medication. It'd be like taking pain meds to help your ankle not hurt, despite knowing it's sprained or broken. You would pay for that. The same thing is true with this. Now, there's other meds that also create a lot of issues. So once again, use it for a Band-Aid is what it is. But if you have to take a medication, you know you need to take a break. So what are the symptoms of concussions and traumatic brain injuries? As you'll see, there's a lot of this. Pause it right here. Look, see how many you have, but vision problems, dizziness, mood changes, fatigue, emotional, concentration, neck pain, and so much more. What are concussion myths? Absence of symptoms equals recovery. No treatment available. Also, no evaluations even available. Concussions are mild. You must lose consciousness. You must hit your head. And no long-term impact. These are all myths that prevent people from getting the proper care they need in the short term, but also taking care of their health in the long term. So what should actually be evaluated with a concussion? So this was published in the British Journal of Sports Medicine. You'll see there's a lot of overlapping things in here. So you've got vestibular, you've got cognitive, you've got fatigue, you've got anxiety, mood, you've got headache, you've got ocular, which is eye movements. You'll see all these symptoms. Okay. So if you go and someone only evaluates you for your mood or your cognition, can we consider that a complete evaluation for your concussion or traumatic brain injury? The answer is no. So if they only do a partial evaluation, they can only at best ever recommend you a partial treatment plan, which means at best partial results. But you've got all of these layers, so you're really diluting it down. So it may be partial results or just no results at all. I mean, concussions and traumatic brain injuries, I love them. There's very predictable results in most patients, but they are challenging. And if you're only coming at it from one little angle, you can't expect the best results. So what happens in the brain following a concussion? Your provider must know this. Now, this next part, I could honestly spend a few hours on this. I'm going to cover it briefly. One is that there's immune changes in the brain. The brain becomes inflamed. Let me explain it like this. I grew up somewhere with hurricanes. So anytime a big storm comes through, right, the storm is gone. It's not there. It's still not doing damage. It left. But it causes things that have to be thrown away. There's a lot of damage and debris. You've got to take and get rid of it. So the brain becomes inflamed to deal with that. After a set period of time, typically about 2 weeks, the brain shifts into a reparative state. It says, okay, you know what? This has been damaged, but we don't actually have to throw it away. We can fix this and repair it. That's what the brain should shift into. With these injuries and some of these other things I'm going to cover shortly, that can shift the brain into just more of an inflammatory state where it takes things that shouldn't be thrown away and it throws it away anyways. Next, the brain doesn't produce and use energy the same way. So think about like you've been driving a Civic, right? So you're getting good gas mileage. Now with a head injury, you're driving an F-350 that's jacked up. So you can't expect 10 gallons of gas to get you to the same place. Now, when the brain runs out of energy, the parts of the brain that are needed for survival will always get the energy. So these are the mood centers. So people tend to have more anxiety. They tend to have more depression. They tend to be more irritable, and there are other stuff that you want, like focus, concentration, word finding, memory, goes down. You also may notice your vision changes on you throughout the day, all very common. You also can have reduced blood flow and oxygen to parts of the brain. And lastly, the part that we can evaluate best is impaired connections. Your brain is a network. It's not just this part of the brain works in isolation. There's these networks of how they work together, okay? So frontal lobe, yes, it may do stuff, but it works in conjunction with other things. If all 4 of these are not evaluated and treated, do not expect a lasting recovery. One of the biggest mistakes I see people make is they go and get one of these done and that's it. The other big mistake I see people make is finding the one trick pony. So they'll be like, ooh, I heard great things about, let's say, hyperbaric for it. And I went and did it and it helped me a little bit or it didn't help me at all. But they did it because someone else said it was amazing. But that's only one pillar. And my question is, just because symptoms improved, who said your true functionality has improved? And that's where I get into the importance of a proper evaluation. If you're not measuring those brain function tests, you can't truly say you improved your functionality. It's more of a Band-Aid. But first, what you bring into the concussion and traumatic brain injury matters. So what are pre-existing factors that you should know? Once again, pause this. How many of these did you have before the injury? Mood issues, hypertension, abuse, PTSD, diabetes, prior head injuries, medications. Here, I break it down a little bit more into different types of medications, infections, autoimmunity, and so much more. What are labs that should be looked at? Hormones, inflammatory things, blood sugar, and so much more, right? Vascular health is brain health. If your cardiovascular level stuff is off, well, that goes to your brain as well. So that is setting the stage, right? Don't try to rehab the brain if all of that stuff is off a lot. It just doesn't work as well. So what should you actually be looking for in a concussion and a traumatic brain injury evaluation? Vestibular, which is also balance, oculomotor, which is eye movements, and then brain waves. So this is a balance assessment that we do. It's a part of the balance assessment. It's not all of it. So you stand on a firm surface, eyes open, eyes closed, and then a perturbed surface, eyes open, eyes closed. One of the things the research shows is that whenever people have concussions and traumatic brain injuries, they become more visually dominant with their balance. So if you have them close their eyes or they have to do things that very quickly reflexive movements, they don't do as well and they're more prone to fall and have issues. So the last two, vision and vestibular, eyes open, eyes closed on a perturbed surface, we see 0% and 3%. So that means if they went against 100 other people, those numbers are how many they'd beat. So 0% and 3. But here's what happens after treatment. 123 to 29, 170 to 65, 40 to 15, 99 to 33. Disclaimer, when you see 99 percentile, that means they beat 99% of everyone. So that's not the results most people are getting, but most would go down from 99 to 50, maybe even in the 40s, because it's about where does your brain need to be. Eye movements. This is not going to the eye doctor and making sure you need a prescription or not. Not what it is. This is using computerized technology where we put on goggles and it records everything they do. So this is an individual who's looking at a stationary dot that had moved to the left, and they have no clue their eyes are moving in the way they're moving. Okay, so even if someone says I don't have visual issues, I'm always going to do this because only upwards of 20% of my patients even have an accurate idea of what their eyes are doing. Here, tracking left and right should be moving nice and smooth. What you'll see is there's nothing nice and smooth about this. You've got skips, you've got pauses, you've got eyes basically, right? Let's say oscillating back and forth. Once again, people don't feel this. Very few people do. But it's no wonder to me when I see this, that it's like, oh, well, you're fatigued. You don't remember what you're reading, huh? You probably have chronic neck pain that doesn't improve. You probably are anxious. Yeah, how'd you know? Well, because your brain's telling me. Same thing, up and down. Should be moving nice and smooth up and down. Anything but nice and smooth. Like, why is there all these horizontal movements in there left and right? The dot wasn't doing that. It was, you followed a target that went up and down nice and smooth, not one like that. So this is part of what should be done in an eye movement evaluation. This part takes us a solid 30 minutes. The other thing is we use red-green glasses. We do different things where we're looking at convergence. We're doing different things where we're saying, okay, are there changes in eye position when something's covered that shouldn't be there? It takes time. All the balance, all the eyes I've shown you up to this point in time, just the technology part takes 45 minutes. That's not the other part. So don't try to shortcut the process. If someone says, I evaluated your concussion in 30 minutes to an hour, they didn't. It's not possible. Okay. You can screen someone, but you can't really evaluate them at the level that should be done. Next, this doesn't have to be done in everyone, but often is useful, is using brainwaves using a QEEG, quantitative electroencephalogram. So what we see with the colors is this is parts of the brain that has an excess of those brainwaves. So we really want a good gray in there because we don't want too little, we don't want too much. There's this balance of what should be. So as you can see, there's a lot of stuff that should be in an evaluation. You should be going through your entire past history. You should be going through labs. You should be going through a full functional assessment of neurological function. Now, are there long-term issues? Here's what the research shows. Chronic traumatic encephalopathy, suicide risk doubles, dementias, Parkinson's, multiple sclerosis. In the military population, they found out one concussion with or without loss of consciousness doubles Alzheimer's risk. Now, this doesn't mean one concussion will give you Alzheimer's. It just increases the risk. Now, this is one of a laundry list of things that increases the risk. They looked at over 4,000 individuals who developed dementia. And what they found, 1 in 6 developed dementia after a concussion within 4 years. So older adults had a substantial long-term risk of dementia after a concussion. This is a really big deal. So don't think, oh, well, you know, mom just had a slip and fall, or my wife had a slip and fall, or I had a slip and fall and I'm okay. I'm a guy, I'm strong. You know, took a concussion, had a headache, dizzy for a little bit. It's okay. No, it's not. 1 in 6 is a lot. Okay, that is a very high percentage who ended up with dementia within a relatively short period of time. Okay. Do not minimize it. So often get asked, well, how long can these changes persist, right? So we do know it increases the risk of dementia. This was a survey study that they did. They sent out to people who they knew had concussions, and they were trying to see where were they at in their recovery. Anything you see in the gray are those that didn't recover. Now, I do believe people can recover years later, but you're not going to magically recover. You can't sit and wait it out. You can't medicate it out of you either. There's not enough Adderall, there's not enough Prozac in the world to do it. Well, what are the symptoms people have? And it's sad, but a lot of my patients who come in that I ultimately treat for concussions don't even realize it's their concussion. They think it was whiplash. They think it was something else. But you look, headaches, concentration, 70%, fatigue, brain fog, mood issues, neck pain, and so much more. I mean, pause it. See how many of these, how common these are. Almost half of these symptoms are 40% or more of people. Okay? These don't magically go away. Don't chase the headache. Don't chase the fatigue. That happens. Oh, well, I went to someone and they say it's my thyroid. They said it's my hormones. Well, not if you have a concussion. I mean, there's like, yes, it can be your thyroid. It can be your hormones. But I also see those oversold a lot of the times when it's not off enough. But because the provider, they're saying, is doing the best they can, but they don't understand concussions. And they have no clue the patient even has one. Can symptoms change as time passes or even come back after being gone? Well, what they found when looking at traumatic brain injuries in military, service members with concussion experienced evolution, not resolution of symptoms from 1 to 5 years. Okay, that was PTSD, depression. And then nearly half of individuals who experience mild brain injury will continue to experience persistent symptoms 1 year later. What are things that increase the risk? As we talked about above, prior brain injuries, using psych meds, other issues as well. You know, recently there was a study by the Journal of the American Medical Association where it's published 56% of people at 6 months were considered not recovered. So as we go into the treatment side, we've talked a lot about evaluation because the treatment itself doesn't matter if you don't have the proper evaluation. Everyone's trying to look for the magic. There's not. It's a comprehensive approach. And also remember, there are no bravery points in brain rehab. Don't keep pushing to your symptoms. It's one thing to get a little blurry vision. We get a little bit of a headache and that dissipates. But if you have a headache and then you keep going and going and going and it becomes worse and worse and worse, you're only slowing recovery. Now, what I found is a unique treatment approach is the difference between helping some and most of the people. As great as my experience was working at that clinic, there were a lot of people that got long-term results, but there were also a lot of people that came in, they did well, and the results faded. And here is why. We are focusing mostly on the brain. We did some stuff on the body, but we didn't really keep with it. And the other part was mind. We didn't address their stress response, their past traumas, or anything like that that was impacting them. And what I found is when all three of these are evaluated and treated as a whole unit, people get the best care, which means comprehensive care, not disjointed care, not, well, I'm going to do this for a few months and then I'll go to this for a few months. That's like playing football and saying, okay, well, block on this play line, don't block on the others, and then run the right route. But no, it has to be done together as a whole unit. If not, best results aren't really possible. And I want people to have the results. I don't want it to fade into this false wellness point that I've seen happen. There's a way to do it, but you have to keep doing the things that get you there. Now, that doesn't mean you have to keep going into an office for care all the time, but it does mean that things you're given, lifestyle things, exercises to do need to be done. There's no single approach that works for everyone. I hope I've beat that one enough. Rehabbing the brain is like growing a plant. It takes the right plant and environment, which is different for each plant, right? Like some plants grow better in certain things than others. And that's why as much as you may Google and it's like, oh, well, this works really great for someone, it bombs for a lot of other people. And that's why one-trick ponies hurt a lot of people, because people put all of this stock into it. And then when they don't get better, they're just like, oh man, I can't get better. And it's like, no, like you did one thing. That's concussions aren't that simple. You need a comprehensive approach. So let's go back to the beginning though. How many of you experienced something similar to my wife, Sarah, before she got care, where you were struggling, you adapted it, you thought it was your new normal because it was so common? Now, who would like to get their life back? Like her and nearly 1,000 other patients I've helped with concussions and traumatic brain injuries. The key to this is having the right guide. You need someone that knows where to look and can put together a plan for you, not a predetermined thing that they're going to do with everyone anyways. So what I do is I always start with a discovery consultation. This is for those who are doers, those who are ready to act to obtain better brain health, those who are looking for a different approach to get new outcomes for their concussion and traumatic brain injury symptoms. Once again, a different approach, not the same. Those who believe their future can be better as their brain is better and healthier. Those who know their health is the number one priority and is worthy of investment, and just respecting your brain. Those who are determined to not adapt to a new normal. Now, during the session, we are going to review what you're needing help with right now. What's going on? Like, what have you tried? What's been the outcomes? Why do you think you're not getting better? Well, what do you consider a win? So if I did accept you in a care, what does that even look like for you with a win? And if those are things that I feel I can help, I'm going to tell you, yes, I can help you. No, I can't. And I'll say, here's how we get started. Here's what I need from you, from other providers to best help you. And as you can tell, most everything I've shown you, most of you have never had this before, because it takes time. The evaluation takes anywhere from 1 hour and 45 to 2.5 hours to really get through everything we need. Now I understand you're like, cool, you're saying all this stuff. It makes sense. It even sounds exciting, but I don't know. Have you even helped anyone? Well, each one of these is a different review I have from someone. Now there's many more of this. These are all on Google. But what you'll see is some of these are acute, brand new, others years, where people are now getting outcomes that they didn't think were possible. And once again, it all starts using the right approach. So if you haven't already scheduled that discovery consultation, you haven't done one before, here's how you request it. Go to idahobrainandbody.com to do it. if you've already had a consultation. I hope this is enough to help you act. Okay. I really want you to take this information and to move forward with it. I don't want you to look back with regrets, because outside of that, you would have wasted time today. I don't want you wasting time. Okay. Each day you suffer takes a bit from you, and you can only give to others what you yourself possess. So take care of your health. Here are the steps that help people get treatment plans that are individualized for them to get the best outcome. So I know I covered a lot of great information. I know you'll find this really beneficial, especially if you act on it. If you don't act on it, it doesn't matter what information anyone gives you. It will never be sufficient. So look forward to meeting you in my office. And if you've watched this, let me know.